Hello, my name is Lena Richter. I'm a marriage and family therapist and professional clinical counselor trainee. My partner, Arooshi, and I are very passionate about women's health, especially women's sexual health.
Hi, I'm Arooshi. I know my partner Lena introduced herself and me.
Men's sexual health is more talked about, more common knowledge, and it's even researched more. So we believe it's not only important to research women's sexual health, but to share that information as well. So our topic today is how drugs can affect sexual health and functioning. And we will be sharing this information with women in drug rehabilitation facilities. Okay, so drug use and sexual functioning. In this section, we're going to talk about how drugs and sexual dysfunction are related. So how can drugs affect our sexual health? Let's take a look. So sexual dysfunction. What is sexual dysfunction? Sexual dysfunction is a change or disruption in the way you're able to have sex or the way your body functions sexually. Sexual dysfunction can make it difficult to feel physical pleasure, experience arousal, can lower your libido, and it can make it difficult to achieve orgasm. It's difficult for women in the first place, and drugs can make it even more difficult. So we'll be taking a look at how drugs can cause sexual dysfunction. Sexual dysfunction can be a result of long-term use, right? Use it over months or years. Short-term use can also affect sexual dysfunction. So using drugs one time, binge drinking one night can affect how we function sexually. We're not safe from negative effects of drugs, even if you take them for a short amount of time or in a low quality. There are many drugs that can affect sexual functioning. These include cannabis, marijuana, tobacco and nicotine, the cigarettes, opioids, which includes morphine and heroin, alcohol, cocaine, amphetamines, MDMA, and nitrate inhalants. So most drugs can affect our sexual functioning, both men and women. Okay, it's important to understand normal sexual functioning if we want to see how drugs can affect it, right? So normally in sexual functioning, there are four phases, which you can see in this diagram to the right. So our first phase is excitement, right? It's that desire, arousal, when you first have that inkling to have sex. So in this stage, you have an accelerated heart rate, your breathing is accelerated as well, and your blood pressure is raised. The vaginal walls constrict and lubrication begins. Right? Lubrication is super important for penetrative sex. Next, you have that plateau. In this phase, there are parts of the body that swell. That includes the breasts. That's because of the blood pressure increase in the body. Next, we have orgasm, right? This is the goal of sex for a lot of people. This is the stage of sexual release, right? That pleasure stage. Then we have resolution, right? It's what it sounds like. After that orgasm, you come back down to normal. So unfortunately, sexual dysfunction, sorry, can occur at all four stages of arousal. So there's so much at play biologically in your body when it comes to sex. Drugs can interfere with all aspects of the sexual experience, from excitement all the way to resolution. Okay. Next, we will take a look at individual drugs and how they impact our bodies sexually. So we know about alcohol. It's a depressant. What's interesting about alcohol in small amounts, it seems to have a positive effect on us, right? It calms us down, calms our anxiety and our nerves, lowers our inhibition. Um, right, so we're more likely to do things we wouldn't do when we're sober. This means our ability to make decisions is impacted. So alcohol is the greatest cause of sexual dysfunction. It can cause sexual dysfunction after binge drinking session or during chronic use. So any alcohol affects our sexual functioning. So as we said, we're going to take a look at women's sexual health. So how sexual health is impacted by alcohol in women. We all know that men can have trouble with erections even after a few drinks. We've heard the term whiskey dick. But I think it's a little less known that alcohol can have effects on women's sexual functioning too. It can make it difficult for women to get aroused in the first place. It can make it difficult for the vagina to self-lubricate, right? It's often you get drunk and you need lube to assist in sex when you're drunk. Can also lead to an increase of risky sexual behaviors, right? It lowers that inhibition or ability to make sound decisions. So we might be having sex with multiple partners or sex that is unprotected. This risky behavior is possible, can result in sexually transmitted infections or even HIV. However, there is good news about sexual dysfunction with alcohol. Abstaining from alcohol for a long period of time can lead to a reversal of any of those symptoms that we talked about. So alcohol may bring on these sexual dysfunction, but abstaining from alcohol can reverse those symptoms. Okay, tobacco and nicotine. When we talk about this can be smokeless tobacco, cigarettes, or even just isolated nicotine, right? Those chew. It even includes vapes. So in men, nicotine constricts blood vessels, causes erectile dysfunction. We know that as well. And we know it impairs the ability to maintain an erection, like get hard in the first place. Women, this is less known. Again, decrease in vaginal lubrication. There are delayed orgasms. It can take a long time to achieve that release or even get there at all. So tobacco and nicotine can affect how we are functioning sexually while we use it. Next, we have cannabis, marijuana. So again, we're going to be looking at how this affects women's sexual health. In women, unfortunately, this is all self-reported findings. There have been no studies that look at women's sexual health while they're currently high on marijuana. Cannabis may increase sexual pleasure, may increase arousal and orgasm satisfaction. However, older women with more comorbidities, right, multiple mental health diagnoses, report higher levels of sexual dysfunction. The type of cannabis and the length of use impacts its effects. So the effects of cannabis can be anywhere from difficulty with lubrication, vaginal lubrication, difficulty being aroused in the first place, and difficulty achieving orgasm.
I know Lena has covered some of the substances like alcohol, tobacco, and cannabis with you all. I'll be taking you through the rest of the substances and just talking a little bit about them and how they can impact women's sexual health and functioning, and also to some extent for men. I think it's good information to have. So next up is opioids. Opioids, as we know are drugs that are also known as like pain relievers or painkillers. They can be prescribed legally by doctors as well, but opioids also include drugs like morphine and heroin. There are different types of opioids, and we are just going to cover the general impacts of opioids, like all of these in general, on sexual functioning. Opioids initial use, which is just low usage, can lead to an improvement in vaginismus. Vaginismus is basically a condition in women where the muscles around the vagina tense up involuntarily. So, what happens is at the start of sex, or if you're trying to insert a tampon, or during a clinical exam at a doctor's office, the muscles do tend to tense up, causing pain and discomfort. Opioids can be used to relax those muscles and relieve some of the pain. So, very initial use, low dosage can lead to an improvement in vaginismus for women. And due to this improvement in the muscles relaxing around the vagina and the pain decreasing, it can also give the impression that sexual functioning is actually increasing, and it's good now. Chronic use of opioids, especially when it comes to morphine and heroin, can lead to a decrease in an hormone called luteinizing hormone, which is also known as LH. It is a hormone that triggers some important processes in the reproductive system for women. It is the hormone responsible for ovulation. So, chronic use can actually lead to a reduction in that hormone, and as a result, it leads to a decrease in testosterone and estradiol, which are also hormone levels for women. And because women are going through hormonal changes as well, and in general, chronic use can lead to a changes in or a reduction in sexual desire. So it can increase the possibility of infertility in women, a prolonged chronic use of opioids. And it is also important to note that some of the long-term effects of opioid substitution therapy, like when someone is trying to come off of opioid use disorder and they are put on like methadone to aid withdrawal symptoms and to assist in getting sober and clean, but long-term chronic use of methadone as well can lead to similar side effects. Next up, we're going to talk about cocaine. I think we all know that cocaine acts as a stimulant. It is a stimulant. So cocaine basically inhibits, like it inhibits the ability of the brain to absorb dopamine and norepinephrine. Dopamine and norepinephrine are basically important neurotransmitters, right, in our brain. Dopamine is responsible for functioning like memory, mood, attention, motivation, and norepinephrine is responsible for like our stress reactions, cognitive functioning, arousal, attention as well. So when cocaine is used in a decent amount of dose or longer term, it can inhibit our ability to absorb these neurotransmitters, impacting the rest of the functioning, right? It then impacts our mood and movement and arousal and cognitive functioning and all those things that those neurotransmitters are responsible for. Um, Cocaine use can also lead to an increased erectile function in men and arousal in women. This is to be noted that this is initial small dosage use. It is not associated with prolonged use. But yeah, initially, because cocaine is a stimulant, it kind of gives that sensation of a high. And in small initial doses, it can lead to an increase in arousal. But if there is a long-term use of cocaine, it does lead to decrease in sexual desire, and delayed orgasms. Delayed orgasms means that even while you are engaged in a sexual activity, you may not experience orgasm very quickly or as you normally would. Like it would take longer for you to achieve orgasm or pleasure with the same sexual activity. So the results are worse when cocaine is combined with other psychoactive substances. So these effects can be worsened if you are also using other substances along with cocaine. Psychoactive substances can also include like alcohol. So if you're using cocaine with another psychoactive substance, an impact that would take, say, roughly, this is just an estimate, like just an example, like 10 days could probably take like 6 or 7 days. Cocaine causes vascular damage in men, and it can lead to a condition called priapism, which is basically painful erection that does not go away. So that is one of the side effects of using cocaine for a long period. Some other long-term effects on the body can also be that it leads to the development of plaque in the arteries. So slowly and surely, cocaine can cause these plaques. So amphetamines are also stimulants like cocaine, and they kind of have a similar function where it kind of inhibits the ability of the brain to absorb those two neurotransmitters that we spoke about, namely dopamine and norepinephrine, impacting the functioning of those neurotransmitters. So amphetamines, again, like in small doses, how cocaine can increase arousal. Amphetamines can also be a very potent aphrodisiac when used in small doses initially. And so another effect of amphetamines is that it can increase sexual desire, but delay your orgasm. So just that you may feel like engaging in more sexual behavior, but you are unable to achieve the same level of pleasure, or it might be delayed for you with the use of amphetamines. Again, because amphetamines are stimulants, it gives like a heightened sense of energy. So you feel like you can continue to have sex and that your body can handle it and that you can have sex for longer periods, but it does impact the ability to achieve pleasure and leads to delayed orgasms. Prolonged use of amphetamines can lead to erectile dysfunction. It can lead to low sexual desire, and it can lead to, pardon me, it can lead to a condition known as anorgasmia, which is basically delayed or absent orgasm even when you're aroused. So they really do impact your ability, one's ability to achieve orgasm. Men can become known as crystal dick when they are using amphetamines. Crystal dick basically is like a strong desire to have sex, but the inability to achieve an erection or orgasm. So you feel like having sex, but you are not able to either have an erection or unable to achieve an orgasm. So it impacts men similarly. So MDMAs are also commonly known as like ecstasy. And I think the association of MDMA is very strongly associated to being known as a party drug. MDMAs lead to an alteration in your mood and perception. Short-term use, again, it can cause a sense of heightened experience. It can lead to an improved sexual experience, like short-term small dose use. It's also known as the love drug, party drug. People use it to get that immediate satisfaction and that improved sexual experience. But again, being mindful that it can impair your sexual functioning. It can lead to an impairment in your erections and again, delayed orgasms with chronic and long-term use. Lastly, we are going to cover nitrite inhalants. They are also known as poppers. They are basically substances that, when inhaled or consumed, they cause your muscles to relax. It can also cause your blood vessels to dilate, so they basically get bigger. Nitrite inhalants can be used to enhance men's sexual functioning because of the impacts that it has on the body. And again, it's used as a muscle relaxant as well. But again, like all other drugs, long-term and chronic use can lead to erectile dysfunction, and it can lead to high-risk sexual activities. Your inhibitions are lowered and you tend to engage in riskier behavior and sexual activities. So that pretty much covers all the substances and the impacts that they can have on our sexual functioning for men and women. I think it's important, I think, to note that I think across mostly all substances, short-term small dose use can sometimes lead to an increase in pleasure and sexual functioning, and you get the sense that if you keep doing that, it will continue to improve. But then the pitfall is that long-term chronic use, depending on how long you've been using, how many substances you've been using, it can have adverse effects on sexual functioning, especially leading to inability or delayed orgasms. It impacts lubrication, it impacts a sense of pleasure, among many other things. And I'm just going to go over some resources again that we found. So these are just resources that you can access online as well. If you just need more information, you don't feel like you're ready to talk to someone as yet, but you do want more information and you do want to research what's going on with you and your body, please avail to these resources. SAMHSA is the Substance Use and Mental Health Services Administration. That is the helpline for SAMHSA. It is available in English and Spanish. It is for individuals and families struggling with substance use disorders. So if you want more information on the substances that we have discussed or otherwise, you can just call SAMHSA. It is a great national helpline. It is a helpline that is open all day, every day, and it's free. You don't have to pay anything to call and ask for resources, ask for help, reach out to them. The second resource that we have provided is the Mayo Clinic. So the Mayo Clinic, the link that is on this presentation, and we will provide it at the end of the video as well, basically is a website where you can learn more about sexual dysfunction, things that we have discussed. But if you want to learn more in detail about it, it has information on how you can start treating it, how doctors look at it and treat sexual dysfunction, what are some of the symptoms to look at, information about sexual dysfunction without drugs. And it is a great resource to just look at and dig deep into. And lastly, it is the ASECT organization that we're providing a link for. It's the American Association of Sexuality Educators, Counselors, and Therapists. This website has a list of providers that work on sexual health in California. Providers are listed by location and share their profession, like whether they're a therapist, they're a counselor, or an educator. So you can, if you want, look at this website. It would be great if you want to reach out to someone and seek their advice.
Right. So there are ways to manage and treat sexual dysfunction when it occurs due to drug and alcohol use. There are 4 stages that we can look at to treat our sexual dysfunction. The first one is finding that relationship between sexual dysfunction and drugs. So it's important for each person to understand the relationship between substances and sexual dysfunction, sexual health, and how it relates to them. How exactly are they impacted by drugs and alcohol? Second step might be self-explanatory, is to maintain sobriety. Do the symptoms, oh, noise. Okay, the second step is to maintain sobriety. Do the symptoms decrease when the person is sober? Does the sexual functioning increase? This might be self-explanatory. Sobriety, right? If drugs and alcohol are causing the symptoms, do they reverse? Do they heal themselves when the person is sober? Then the third stage, if those symptoms are persisting even after you're sober, it's important to consult a doctor and assess whether sexual dysfunction persists or does continue while you're sober. And the last one we look at is organic problems. Are there any health problems that are leading to the sexual dysfunction? Is it because of the drugs and alcohol, or were these problems in your body before the drugs and alcohol? Did the drugs and alcohol exacerbate those problems? This is the time to consult your doctor and do a physical exam. If number 4, right, if there is a physical problem in your body, this is when it might be prudent to look at medication. The problem is indeed organic, right, from your body. It's time to look at medicines and treatments. In women, there's a topical estrogen that can improve vaginal lubrication and genital arousal, make it more easy, or make it easier for women to experience arousal. So again, there are treatment options for women who have experienced sexual dysfunction due to drugs and alcohol. Thank you so much for learning with us today. We hope you learned more about women's sexual dysfunction and about your health in your body. So important to know who we are, and that includes sexuality. If you would like more resources, here are some articles and studies that might be helpful for you. These are what we used to find our information today. Thank you.